I'm Simon Benson. I'm a GP. I still practice half a session a week, and I'm the Director of Clinical Innovation and Genomics at Bupa.
Oh, super cool. And I actually wasn't even aware that genomics was within the wheelhouse of Bupa. Tell me more about that.
Everyone knows Bupa is a health insurance company. We actually have a very large health services business. It's the largest single employer of healthcare providers in Australia. We look after the Defence Force. We're building out a network of GP clinics, mental health clinics. And Bupa's vision is about helping people live longer, healthier and happier. And so as part of that, not strictly linked to the insurance, we look at new ways of delivering care, new models of care, new ways of doing preventative healthcare. And one of those is genomics or genetic medicine, which I think recently has come into its own.
Yeah, interesting. And so what brings you here to the Best Practice Summit?
I think best practice is the cornerstone of primary healthcare. I'm a bit of a data nerd, and I love the power of data, and I think there's so many secrets inside all of these records, which currently are, in some cases 20 years long. They're all free text, they're all unstructured, and this is the time with AI and with some of those tools that we now have that are probably good enough to start to help us make sense of all that data.
I find that topic interesting, and I've touched on it a couple of times in the past, is there seems to be this great opportunity then, sometimes when you introduce some new technology, you then kind of start the clock and you have to build the data set and because it's in the new system or it's in the new kind of format, and that's going to take time to then see the benefits. So you've got to kind of trust the process. This concept of being able to retrospectively apply new technology to, I guess, information that was once kind of dormant or not useful in the format that it's in, is that a goal or an eventuality, or are there examples of that kind of stuff happening now that really give us some inspiration to do even more kind of things like that?
I mean, I think that's happening now. I think it's still in its sort of early days. Like the AI is pretty good, or can be pretty good if appropriately trained, at turning that unstructured free text that we write in our clinics into something that is structured and coded and searchable. Then what happens is you end up with very massive data sets that almost no human could actually look for those sorts of correlations. And that's where those very large models come in to actually help look at the correlations between, I don't know, if somebody visits 5 times and they have X diagnosis, 5 years later, are they more likely to have cancer or not? It's not causal, so it's not directly linked, but you start to look for correlations and indications. It might be, dental cases, for example. We know that bad oral hygiene is related to heart disease. We've known that for a while, but have we linked it to the number of dental appointments that you have, or what there's a score they use in dentistry called DMFT, the number of disease, missing or filled teeth. Can you relate a DMFT score to someone's actual risk of developing heart disease, which then says, maybe our scoring, where we use blood pressure and we use cholesterol and other metrics, maybe your DMFT score becomes one of those markers for heart disease, and we can actually put a number on it and say, if your score is X, then your risk is Y. But you need massive data sets to be able to look at that.
That's interesting, and I guess it depends. It makes me think then, well, what do we do with that information? I guess that kind of information and insight, or like where the ball might be going, is particularly useful on Bupa's side. But I imagine if we can get into the right format and then provide the right education and support for a patient, being empowered to be able to have that foresight can kind of help you make some good health choices. Is that the direction that we're going here?
I firmly believe that patients own their own health data and they own their health record. But I would say, I don't know if have you seen your full health record? I'd probably guess not. I certainly haven't seen
the definition of a full health record is such a
But you should, right? You have a legal right to access that. But how do we actually put you in control of your health information so that you can actually make those choices and have those insights for yourself? It's all very well knowing what you need to do to help prevent illness, etc. But getting people along the journey, driving engagement, everybody knows you need to not smoke, yet people smoke. People know that you need to exercise regularly, eat healthily to reduce your risk of various things, yet they still do it. So
Yes.
how do you actually harness and drive engagement? You're never going to win with anybody. But I think it's a really important challenge that you bring up is how do you get people to engage with their own health? And that's probably another power that will come with information.
Yeah. And lastly, then, looking ahead and I guess in the landscape of all of that innovation, the potential and all of that, what do you look forward to seeing, either from Bupa or just more broadly across healthcare over the coming months and years?
I think more of a preventative focus. I think we're very reactive in our healthcare. And if you kind of think about it, that kind of worked 20 or 30 years ago. Heart disease was the leading cause of death.
Yeah.
We aggressively attacked that problem. And as a result, now people aren't dying in their 50s and 60s. They're living longer.
Yeah.
The models of care that we used to deal with heart disease and before that infection with antibiotics are not going to work moving forward. We have different health problems because we have been so successful at hygiene, antibiotics in infection, identifying blood pressure, treating high cholesterol to deal with sudden cardiac events. Now we're in a sort of chronic disease world where it's probably a little bit more metabolic. So how are we going to change that? And we know that it takes many years for those metabolic risks to catch up with you. So that's what I think will be the most exciting bit, is how do we actually start to change the models of care? How does the information age, which is what we're in right now, how does that help that? And that's where I'm super interested in the power of genomics and genomic medicine is, whole genome sequencing, which is where we sequence your entire genetic code from beginning to end. It's a 200, 300 gigabyte piece of data.
Yeah.
And you effectively can use a data exercise to look for mutations in various genes. Now, the number of genes that you can look for is quite small. The number that are linked to disease reliably is even smaller. But as we start to do more and more of this and you link someone's genetic code, which we call the genotype, with the conditions that they have, which is called the phenotype, you'll start to identify more and more of these kinds of linkages. You can't change your DNA, but what you might be able to do is look earlier. If you have a higher risk of developing bowel cancer, well, maybe you should have a colonoscopy or a poo test every 12 months instead of a different period of time, depending on your own individual risk. And that's hasn't been possible before. I mean, even now it's under $1,000 to get your whole genome sequenced. And it's falling. It will be within reach of many people. But then a 200 to 300 gigabyte file per person multiplied across a population to actually start to look for some of those linkages with genes and your outcome become impossible without support from the information age, which is what we're in now. So it's almost a little bit about how all these technologies are coalescing together, because we've been able to do whole genome sequencing for years.
Yeah.
But that's the power, that's the bit I think that I'm excited about.
Cool.